Hello, my name is Keon Aarabi. I'm an MPH student here at the University of Utah, and this is my poster titled, What COVID Did Was Shine a Flashlight on the Things That Were Already There, a qualitative look at the pandemic through the community health worker lens. Here in Utah, we know that the COVID-19 pandemic disproportionately affected people living in diverse communities. For example, Latinos comprised less than 15% of the state's population, but represented more than 40% of the COVID-19 cases in the state. On this project, we sought to analyze a focus group of 7 community health workers who work in Utah's underserved communities. The focus group lasted 2.5 hours and was hosted on Zoom and included contributions to both English and Spanish. Here's our thematic network that we generated based off the major themes. This was inspired by one of the quotes of the community health workers that really stuck with me throughout the process of qualitatively analyzing this data. And it was that the pandemic was like this flashlight that just was shining a light on the things that were already there. But these issues of health equity and social determinants of health were already there and were already affecting diverse communities in Utah. But the pandemic just highlighted it for everyone to see. Here you can see that each beam of light is one of the major themes that we came up with from the data. Here in the middle of the poster, you can see quotes directly taken from the focus group. Some of the quotes that I really like to highlight are here. One of them being, when they had a trusted voice, it helps them filter out all the mess. I had so many people say they would not have done it if they had not been at the church, a place where they trusted, a place where they were comfortable. This is talking about the vaccination. So one of the community health workers was able to host a vaccine clinic at their church. And they talked about how it being a trusted place and a trusted voice was really able to help people feel safe in getting that vaccine. And some people had said that if it wasn't at the church, they might not have gotten it. Here's another great quote. The higher ups are making all these plans and decisions and not knowing what's going on the ground, implementing all these great ideas that they have, and then it's ineffective or they don't work. And here's talking about the community health workers felt like they weren't included right from the get-go of the pandemic response efforts. And they felt like all these plans were made and implemented, and then when they got to their communities, they said, hey, that might work for other communities in Utah, but it might not necessarily work here in the diverse communities. Here's another quote that I really like. When the pandemic hit, we were asking for things in Spanish and they said no. So here's talking about the community health worker were saying they were asking for pamphlets and other informational materials and educational materials in Spanish. And at first they were told no. And then when they did get to them Spanish, there were mistakes like describing distancing. So in feet, so somebody who speaks Spanish might not understand 6 feet, they would understand meters. And this just describes some of the communication failures that occurred. Over here, we have the social ecological model. And I think the social ecological model does a great job at explaining how each level, individual, interpersonal, system, and public policy affected how the community health workers were able to work and provide pandemic assistance in their communities. One thing that I think is important to highlight is that the community health workers felt like they were not seen as frontline workers at the beginning of the pandemic. And when vaccines were first offered to frontline workers, they were not included. And I think this just demonstrates how community health workers are not seen as frontline workers and as essential workers in their communities. So to end, I think it's important to highlight the discussion. The community health workers felt that the SARS-CoV-19 pandemic response in Utah failed to engage CHWs effectively in planning, development, and implementation of public health prevention and mitigation strategies. Future efforts should include community health workers as essential workers and partners in all aspects of public health outreach. I think this is important to acknowledge that moving forward, community health workers need to be engaged from the very beginning, from the planning all the way through. And if that's done, I think that we'll see an improvement in outreach in issues like the COVID-19 pandemic. I want to thank you for coming and learning about my project. I really hope you can read through some of these other quotes that are here. And if you have any questions or comments, please reach out to me. Thank you, and I hope you have a great day.